Well, Clarity is a fairly young consultancy set up 3 years ago by two partners called Mark Smith and Andrew Moore. Mark's got a health background. He trained as a nurse but has held senior management positions in many NHS organisations. And Andrew Moore is a lawyer by training but went into consultancy with the Big Five quite early on in Australia and in England. Clarity's got 100 associates, of which me, Dennis Gibson, and Sarah Wilson alongside me are just two of those 100. And Clarity also employs about 15 analysts and consultants with very varied backgrounds. We've got with us today a colleague who's a doctor by training and a colleague who's a psychologist, and a whole range of people amongst those 15 who've got strong analytical skills.
Yeah, so Clarity takes a sort of 5-stage approach. We'd start by scoping, so what exactly is in and out. We then spend quite a lot of time really trying to establish the current state of the organisation, really understand where they currently are. We'd look at the drivers, both internal and external, and then we'd look at opportunities. So what could we do in order to put the workforce in a better place? And once we've got all that information, then we've got the current state, we know where we are, and we're looking at future options. So how do we get there? What's the implementation plan? Sorts of conversations we've had are people raising the issues they've got. For example, one delegate was talking about supporting nurses, the health visitors and school nurses, with public health moving over to local government. The issues around not having the professional support that they would have had when they were in the health service, and in the long term that has an effect on morale. So what can be done about that, as an example? With nursing generally, it's an ageing workforce. Recruitment issues, high turnover, what could be done to encourage nurses to stay in the NHS?
Yeah, let me mention two things. One of the colleagues with us today is working with NHS England on quality issues around commissioning of health services, but on an agenda that is equally valid in local government where services are being commissioned, particularly social care services. And another project that I've been personally involved in is with the Vanguard Project in primary care in North East Hampshire, which is really looking at a workforce plan in a very difficult environment where there are too few GPs. The ageing nursing workforce that Sarah's alluded to is going to be a challenge for them over the next few years. And what are the alternatives to the traditional deployment of doctors and nurses in primary care, and how do you plan to get out of that situation that they're in?
Well, I think one of the highlights, quite an entertaining one, was the image of a pinball machine. And the idea that that's where we're in, and the idea of the ball pinging off different levers at different times. And I think that just illustrates very clearly in my mind the complex environment in which we're operating in. And there isn't a linear plan, it's very much an organic approach that's needed. And the sort of bespoke work that's needed in that sort of situation is something that Clarity can offer.